Kidney pie up.
Kidney pie.
Hold the stones. Oh, hello. Welcome to the Decision Diner. I'm Doc Decision. I bought this place a few years back when healthcare really started to change. You know, back then, our menu didn't offer very many choices. Here's one here. Check it out. But you know, most of our patrons back then, they didn't complain. They pretty much left the healthcare decisions up to us. But then, the healthcare paradigm began to change. I had a paradigm once. Today, patient rights like informed consent and advance directives mean we have a legal and ethical obligation to our patients to help them understand all their options and respect their final choice. The way we serve treatment to our patients has changed too. We used to deliver service in a hospital inpatient setting. Our job was to find the problem and fix it. Kind of like a mechanic. Hey, Dee Dee, that pasta's ready. Today, we're managing illness more than curing disease, usually on an outpatient basis. You know, a lot of the folks we see in here are long-time patients with chronic illnesses.
Must be the food you serve.
Ain't she a doll? People are much more informed about healthcare today, too. I mean, how could they not be? There's more information about healthcare on the news, in the paper, even on primetime television. Nice-looking guy. Sad thing is, some of my staff are having a tough time learning to share decision-making with their patients. Excuse me. Hey, Pat, your burger's up and table 7's yours. Check out good old Dr. Pat Ernest over there.
Well, Mrs. Rogers, the best way to deal with this bladder control problem is to use Depends.
What?
Use Depends. Loss of bladder control is just a symptom of old age.
Oh. Well, if you say so, Dr. Pat. But my daughter was saying something about some other kind of treatment. Or maybe even surgery might help my problem.
Now, Mrs. Rogers, let's leave that medical stuff to me. After all, I've been your doctor for over 25 years now. I think I know what's best. Don't you?
Well, of course, Dr. Pat. I'll buy some hens like you suggested. But I really don't understand how they will help my bladder problem.
Yep, that's good old Pat Ernest. He has a real hard time with this new paradigm of shared decision-making. It's enough to make you depressed. Now, on the other hand, you have clinicians like Justine Facts out there. She goes to the other extreme in this decision-making paradigm.
Well, Mr. Klott, your tests indicate that your coronary arteries are occluding. Your treatment options at this point would include balloon angioplasty. This is an outpatient treatment, Mr. Klott, in which an expandable balloon is inserted into the artery, thereby allowing a more free flow of blood through that artery. You see what I mean? We also have drug therapies that are a possibility for you that could actually simply dissolve that nasty plaque. We could go with rotoblade or arectomy. In this procedure, Mr. Klott, the plaque that is clogging that artery is removed via a drilling or scraping technique. So, will it be?
This all sounds pretty risky to me. What do you think?
I'm sorry, Mr. Klott. I'm afraid that decision's going to have to be completely your own. After all, it is you who's going to have to live with the results. Oh, I have a table. Excuse me.
Yeah, that's Justine Facts. She gives the patient a lot of clinical information, but wants no part of the actual treatment decision. She really doesn't believe in shared decision-making either. For her, everything is a toss-up. So exactly what does it take to create a shared decision-making model? Well, first of all, shared decision-making takes at least two people, the clinician and the patient. But most of the time, there are other people who influence the patient's final treatment decision. Patients get all kinds of advice, suggestions, and opinions from family members and friends who play a number of different roles in the decision-making process. the clinician has to remember that the treatment decision is often based on input from these people and take those roles into account. Now, I'm not saying you have to butter anybody up, but during the assessment and communication process, the individual patient, the family, the whole support system has to be considered. Second, there must be information sharing. That's a giving and taking of information from both the patient and the clinician. And finally, both the clinician and the patient must take responsibility for taking steps toward participating in the decision-making process. Ultimately, the clinician leads the discussion with the patient. Good job, Joe. So it's the clinician's responsibility to help move the patient to a more collaborative decision-making model. Now, fortunately for my business, Pat and Justine, well, they're extreme cases. But the truth is, very few on the staff understand how to adopt a shared decision-making philosophy. That is, until Dr. Collaborate came along. He brought a new shared communication technique for his patients. Believe me, people are waiting in line to be served by Dr. Collaborate. He's out there at table 4 right now. Go take a look.
Hi, Mr. Sweet. Did you get that garden in yet?
Yeah, Dr. Laborate. I just put in the tomatoes last week. And the beets, carrots, cucumbers are all doing great.
Well, there's nothing really like a homegrown tomato in my book. So what can we do for you today?
Oh, I don't know, Doctor. I just haven't been myself lately. I eat like a horse, but I'm losing weight. And I can't seem to quench my thirst. My wife thinks it might be diabetes. She's pretty worried about it.
A disease like diabetes can be pretty scary at first. Is there anything else that you've noticed that's not exactly normal for you?
Well, now that you mention it, I have been urinating more than usual. But I thought it was just because I was drinking too much.
Is there anything else?
Nothing that comes to mind.
Okay, well, I know that you're worried that this could be diabetes, but to know for sure, we'll need to do some tests, including a blood test. If the sugar in your blood is above a certain level, it means that symptoms that you've been experiencing are the symptoms of diabetes. Until we know for sure, it's too early to talk about specific treatments. But I'm curious, what is it that worries you about the possibility of having diabetes?
Well, my uncle has diabetes. He had his foot amputated and he's confined to a wheelchair. I don't think I could handle that.
I can understand your concern, but if you take care of your feet and you follow a few easy precautions, even if you have diabetes, that doesn't mean you're going to lose your foot. Tell you what, I've got some brochures here on what diabetes is and how it affects the body. Karen here will take a little of your blood and help you schedule the rest of those other tests. She'll tell you about the tests and explain to you what you need to do to get ready for them. Since you mentioned that you were concerned about how you've been eating, you might want to look at this section on food choices. It will explain what happens to your food after you eat it. When you go home, you and your wife can discuss the tests and go look over the brochures. If it turns out that you have diabetes, we can talk about what we can do together to manage it. If you don't have diabetes, well, then you and your wife have a little bit more information on the disease, and we'll know more about what to look for in the future. How does that sound?
That sounds great, Dr. Labrett. You've put my mind at ease.
I'm glad I could help. We'll call you when we get the results of your tests.
Now that's the way it ought to be. Joe, a little help here, huh? Thanks. Now that's the way it ought to be. Healthcare treatment decisions should be a collaborative effort between the provider, the patient, and the patient's support system. A lot less strain that way. Dr. Laborate and his team have a fail-safe communications technique they use with all their patients. It's called the 4 E's. That is, engage, empathize, educate, and enlist. Physical op, administer rectal exam. Thanks, Joe. You remember when Mr. Sweet was in earlier? Laborate went out of his way to engage or connect with the guy.
Order in.
Order in.
Hi, Mr. Sweet. Did you get that garden in yet?
Then Laborate let Mr. Sweet tell his story while the doctor listened. Laborate even matched the guy's body language. Matched the guy's body language and empathized with what Mr. Sweet didn't say.
So, what can we help you with today?
Oh, I don't know, Doctor. I just haven't been myself lately. I'm eating like a horse, but I'm losing weight. And I can't seem to quench my thirst. And my wife thinks it might be diabetes.
Now, the next step Laborate takes is to educate the patient. Thanks, Joe. Education, remember, is more than just information. Oh, excuse me. Parasite. It also requires the clinician to assess the patient's understanding of that information and to assume there are questions that the patient isn't asking. Well, like Collaborate did.
Since you mentioned that you're concerned about how you've been eating, you might want to look at this section on food choices in the brochures I gave you. It will explain what happens to your food after you eat it.
Hemorrhoids up. Don't let them sit. And throughout the interaction, Collaborate worked to enlist Mr. Sweet in the decision-making process.
A disease like diabetes can be pretty scary at first. Is there anything else that you've noticed that's not exactly normal for you?
Finally, Collaborate works to get adherence from Mr. Sweet. Then, everything falls into place.
When you go home, you and your wife can discuss the tests and go look over the brochures. If it turns out that you have diabetes, we can talk about what we can do together to manage it.
Yep, Collaborate is an expert at dishing up the 4 E's, but he remembers to do his homework, too. Before he ever approaches that table, he sizes up the patient. What is this patient's history in making treatment decisions? Are there any cultural or physical barriers or religious practices that may keep him or her from really being a partner in the treatment decision? Of course, there are times when the patient can't be involved in the treatment decision process, like medical emergency. Excuse me just a minute. And you can't push a passive patient into a fully collaborative decision-making relationship if that's not what he or she wants. But you can help the patient take smaller steps toward a more collaborative relationship. When patients are involved in the decision-making process, they're more inclined to do their part, no matter how simple or how life-changing the illness or procedure might be.
Good night, Doc. I'm cutting out.
Yeah, I'm just gonna scrub up a little. Now, helping our patients make the best healthcare choices for their lives and successfully administering the patient's treatment choice, well, it improves the quality of life. And hey, isn't that what healthcare's supposed to be all about? It's the best tip this place has seen all day.